Good afternoon, and welcome to this next session, which is going to be discussing the weighty issue of what can be done about the lack of men in nursing globally, which there was a bit of overlap with the last session in the main theatre area, if you were in there, I'm sure. So, my name is Steve Ford. I'm the editor of Nursing Times magazine, which is a largely UK-based publication. Started off in 1905. It is now the world's largest nursing website outside of the US. So I'm going to be chairing the session, and now I'm going to get the rest of the panel to introduce themselves. Thank you.
Good afternoon. My name's Jim Campbell. I'm the director of the Health Workforce Department at the World Health Organization in Geneva. Full disclaimer, I'm not a nurse, but I follow the evidence on the role of nurses and their contribution to universal health coverage and how many there are around the world. Perhaps just to put this into context, the question about the lack of men in nursing. What are the figures globally that the World Health Organization has? We recognize that the health and social workforce around the world, more than 7 out of 10 jobs are held by women. That's across all occupations, all professions. When we come down to different occupational groups in the physician workforce, we may see gender parity, 50-50 in many, many countries. When we look at the nursing and the midwifery occupations, we see a very different picture accordingly. And we see 85% of the workforce are female in these occupations. If we disaggregate that by region, again, we get a different picture. So 15 to 20% in the European region, the Americas region, in the Western Pacific region. But here in the EMRO region, as the WHO EMRO region, the Middle East and some of the North African states, we see the percentages rapidly increasing, 50 to 60% across the data. So this is clearly issues around gender, around culture, around education, around models of healthcare service delivery, around engaging both men and women in the profession. So it may not be, there's still a lack of nurses globally for the ambition of universal health coverage. And in some regions, there's a particular lack, 15 to 20%, 1 in 5, 1 in 6 jobs held by men. And we need to be looking at some of the opportunities. So it's not one size fits all. It's not just a global aggregate piece of data. It's how do we look at the realities, the context, the countries, before we look at some of the solutions.
Absolutely. Thank you.
All right. Good afternoon. My name is Sheila Clow. I'm a nurse. I'm co-chair of the Global HIV Prevention Coalition. I'm also co-chair of the Global Nursing Now campaign and former Minister of Health of Botswana. So I've actually been just roped in because we needed to dilute the male aspect here. Yeah, so so it's great to be here. But am I sharing my perspective right now? Okay, my perspective, I have also been UNA's regional director for Eastern and Southern Africa, so that I actually can speak about the countries in Eastern and Southern Africa, but more specifically, Botswana. If you had attended the past session on nursing, universal health coverage and nursing, you did hear from Dr. Moeti that really for Botswana, nursing was always held at a very high esteem. The history was simply because when nursing started, it was the princesses who were put into nursing. And therefore, there was that high esteem even at community level. And therefore, now we're having even princes, the men, joining. And I must say that we didn't actually have to encourage men to come in. They applied, and a lot of them qualified, and they're actually really great nurses. Every year, we have the annual nursing awards. Awards from the nurses themselves to their peers, but also awards from the community about nurses. And it was interesting that this year when I attended, it was actually 50-50, 50% men, great nurses by the community, and 50% women, and they were all getting the awards of excellent service. So it's really to say that it's coming up, and in a lot of other African countries, there are males in nursing. We'll talk about how come they progress a bit faster than the female cadre, because some people have issues with that. But I would say it's not just that in nursing alone. In every profession, if you look at the university, for example, some of us took longer to become professors. Why? Because of the burden of caregiving, where a male would go home and be able to publish and write, whereas you're taking care of family and even elderly parents. So we had to institute at the University of Botswana a daycare center for all staff. And it was interesting that once we did that, we saw a lot more females being able to publish and become professors. So that we need to actually have that gendered, care at whatever level we are giving. So,
thank you. That's a really good point about the progression there. Thank you.
Yeah, awesome. Good afternoon, everyone. My name is Munashe Nyika, and I think I adequately represent the title of this session. I'm a young nurse. I'm a young male nurse from Harare in Zimbabwe. And I would like to start off this session by just highlighting my story and why I got into nursing as a young man. I've always been deeply involved within my community and always have had that passion to want to serve my community and to always want to be there for the people within my community. I've always had this deep interest and deep passion for health, the health of the people within my community. I remember this when I was young, and in the 3rd grade, we were asked to do projects by our class teacher. And she asked us to do any project on any topic that we would want towards that class. And people were doing projects on the solar system. People were doing projects on technology. And I chose, this was at grade 3 level, I chose to do a project on the human body. And this was at grade 3. So I always knew that I was deeply involved within health. And I wanted to do something within health. And through that, I have been able to take that passion into my profession, into nursing, and want to really be a change within nursing, to bring change within health, and to show how much nurses can be able to achieve towards bringing health for all.
Yeah. Fantastic, thank you. Right. So I'll just ask a couple of questions, and I'd like to open it up to you in the audience. So get ready to stick your hand up when asked, and the microphone will come to you. So I'm just going to start off, I suppose, I don't know whether it's controversial or not, but do we need more men in nursing, I suppose, is my question. Essentially, is it a problem that there's an imbalance at all?
The data that we have available says that we need to accelerate the investments in education for the nursing and midwifery profession. We need an additional 9 million nurses and midwives in the next 14 to 15 years to achieve the ambition of universal health coverage. The evidence also tells us that nurses and midwives can deliver effective clinical care as part of a multidisciplinary team. They can improve access to care. The prior panel was looking at the rural populations and access to rural healthcare services, and they improve patient satisfaction. So we need more nurses and midwives. That's the key message first. In some environments, then, we're going to have to look at the reality of getting more men into the profession. Because the graduate numbers from education, grade 12, into a tertiary education, we need to increase the pool. And in which case, then, what are we doing to really advance and accelerate the active engagement of young men, boys, or older men that want to return or come into the profession in a later stage after perhaps a different occupation, a different care experience, to come forward? Because if not, we're not going to achieve universal health coverage. the data I suggested earlier, though, in some countries and some regions, there are particular gender sensitivities. So it does depend on the role, the skills, the scope of practice, and the model of care as to which ratio of men we need. But overall, yes, we do need more nurses, midwives, and inclusive of men.
Thank you. Yeah, so numbers.
Yeah, well, he said numbers, but let me add on to that to just say, as he said, there are some certain, sensitivities, especially at community level. Sometimes it takes a male to be able to speak to another male. For example, as UNA's regional director, I found it very hard to go to the king of Swaziland and talk to him about male circumcision. I had to take one of my colleagues, who's a junior, to say, can you come with me? We're going to meet the king of Swaziland. Firstly, male circumcision is not practiced in their country. So how do I, even as a woman, go and utter that, those ways to him? And it worked very well. So that you do find some sensitivities at community level. Only males can be able to sometimes speak to males. If you are doing, let's say, AIDS education, I think I can see it being better if you are going to follow men where they are, in shebeens, in beer halls. It would be better coming from a male than, a female in there. I've gone in there, but mainly because I consider myself, a human being, and I'll get there and say, let's sit down. I'm going to buy all of you a pint of beer, but let's talk first. So, it's not easy for a woman to do that. Yeah.
Thank you. Great example. So, numbers and practicality, basically.
I think nursing as a profession traditionally has been gendered. Nursing has been seen as a profession for women, and through that, there are a lot of issues that have come up towards being able to challenge stereotypes of men within nursing. And one reason that we do need a lot more men within nursing is to show that it's not just about men or women. It shouldn't be about gender. It should be about people willing to serve and people that want to make a difference, So that's one of the main reasons that we need more men within nursing.
Yeah. Fantastic. All right, so I think we're agreed that we do need more. So therefore, the next easy couple of questions are, what are the challenges and how do we get around them?
I think the challenge would probably be convincing male students to join nursing. But I take it that I don't know what happens in other countries where you have career guidance. In some countries, every student is approached sometimes when they're at grade 9 to interest them in that. So that then I think it would break that mold, and whoever would have any doubts would be able to ask, if at all, whatever questions. But we need to really encourage more men to participate in. And I wanted to add also to say, when it comes to even sensitivities in healthcare, in Botswana, the best midwifery student and the best midwife, that particular award category has always been given to a male. And it comes from the women, mind you. Best midwife has always been a male. Why? Because they say they tend to be more empathetic. A female will say to you, don't scream, what's wrong with you? Whereas the male is able to really take care of you. So, we need that. Yeah, thank you.
Thanks. Okay, Jim.
Some of the very practical steps that we need to take. We may need to make the connection between education and employment. And that education, we touched upon it in the session with Michael Phelps around the issue of masculinity and roles and sort of what is expected of certain gender and certain gender norms. So we need to look at our education in the high schools. The shortage of health workers globally means we need to do active outreach to year 10, year 11, year 12, and even earlier to encourage them to consider a profession, a career in health and social care first of all. And we need to break down those gender stereotypes. The sort of youth of today are much more engaged, potentially globally, than many of the generation that are a bit older in years in terms of what are typical roles. Next, we need to link that to the employment opportunity. We can't just be doing education, and hope that people get engaged in a job, in a career. We need that lifelong learning approach, and we need to link wages, performance, incentives to the career structure. And that is probably the biggest challenge for universal health coverage in the next 10 years. There is not the economic demand to pay wages, decent work, wages which are commensurate with the education, the skill, the scope of practice in the public sector in many, many countries. And so we need to really look at this education employment paradigm, engaging at a much younger age as an attraction in the healthcare professions.
A few issues there then.
So, taking the example of where I come from in Harare and Zimbabwe, and one thing we have found in linking a lot with young nurses from across Africa and within other continents as well, is that male nurses want to be able to be a part of the team. And that's the basis. They want to be seen as members of the team that are not classified as this is a male nurse and this is a female nurse. They just want to be members of the team. You find with a lot of male nurses, there are deep issues with regards being able to be seen as competent in some societies, where you find that some members of society, they say, well, I would rather be taken care of by a female nurse because a male nurse most probably is not good at nursing. But that should not really be the case, you know. At the end of the day, it's about making sure that patients receive the best form of care, and it shouldn't be really about gender. What needs to be done, really, is a change of mindsets within the community. We need to run advocacy campaigns around raising the status and profile of nursing, and that's globally. And really the conversation should not be about men talking about it, but it should also be about women as well. So women talking about raising the status and profile of men within nursing, and men as well talking about raising the status and profile of women as well within the profession. So those are some of the strategies that need to be done, and those are some of the key deep issues within about men in nursing.
Well said. Okay, so I've got lots of questions here, but I'd like to give some people in the audience a chance. We've got a microphone. There we go. One over here, and then there's two over that side as well. Thank you.
Good afternoon, and thanks very much for the presentation. My name is Dr. Deborah White, and I'm the Dean and Professor of the University of Calgary here in Qatar, the only nursing program. And so I had the pleasure of having many of our students here, and male students and female students, and I think it's important to go back to those students and ask why they came into nursing, because I think they would tell you that they came for the very reasons that you're talking about. And so we are trying to increase the number of male students in our program, as well as Qatari male students. And we have male Qatari students, and I think that's a huge accomplishment. So I might ask that they actually comment, because I've heard them speak about what nursing meant to them and why they are there. And so could I just ask one of them to speak?
Yeah. One volunteer, yeah. A reluctant volunteer, perhaps. Anyway.
Hi, good afternoon, everyone. My name is Abdurrahman As-Sadi. I am of University of Calgary, and I am a male nurse student. So to start with, I actually haven't have any idea about nursing. When I start nursing, I have a small clue. I thought that nursing is only like the physician assistant. But with years of getting knowledge and the practice and taking theory, I realized that nursing is really a unique field where nurses have their own specialty and they are able to assist and to communicate with the patient. We are the real caregiver of the patients. But I have a small concern about attracting the male nurses into the nursing field. So my question is, how you expect to increase the number of male nurses when there is like the environment itself is not encouraging? Like for the 4th year, we have been in the clinical rotation when we ask the nurses how they feel about their job satisfaction, their workload, their salary comparing or the job they provide, about the time management, the stress they put in it. So it actually was like they give us the negative image. It wasn't that much encouragement.
Okay, well, it probably sounds like workload pressures probably affects everybody, but yeah. Okay, where's my microphone person? Thank you. All right, I think we had a couple over there.
Hello, my name is Rashid Mungele Salim. I'm a student. Happy to meet my fellow students. And we're talking about what can we do to bring more men into nursing. Maybe we need to study what is it that men want. You and I know that men want to be the heads of the family. Men don't want to be assistants. So if you make nursing to look like it's an assistant kind of profession, no man will come into it. We want to be autonomous. We want to run our own affairs. So right now we're talking about the Nursing Now campaign, where we're raising the profile of nursing. And I see that as an avenue to actually bring more men into nursing. We also lack mentorship. We only have a young nurse. I can't see an old male nurse. So who am I looking up to as a young nurse? We also lack ownership. We have qualified nurses out there, but they don't identify themselves as nurses. They call themselves doctor so-and-so, but I'm a nurse. So we need ownership, we need mentorship, and we need to identify what men will work better with. Thank you.
Thank you. So something perhaps about how nursing markets itself. Would anyone on the panel agree with that?
Well, marketing itself as what? An assistant, a physician assistant, or what?
Sorry?
About, he said...
well, I suppose it's... I suppose some of the job titles are hark back to, obviously some of these have changed in some countries, but things like matrons and sisters and things like that. Is there a stigma problem that in some countries that being a nurse is something that women would want to do?
Well, I think that's why, for me, one of the things we can really do, if only there was money globally, would be to share best practices. Because where some people would call him matron, we would say chief nursing officer. Because therefore it's a gender neutral, it says to anybody. But especially Commonwealth countries, I know that thing of sister that we inherited from Britain and matron is still there. And it's just a question of getting rid of that and recognizing that we have people who are not sisters here and matrons. But in terms of, he also said people call themselves doctor and all that. Well, I'm a doctor, I'm a professor, just like any other profession, but I am a nurse. So I think it's really a question of mentoring and getting the nurses to know that you are a nurse and you can mentor them to be one day a professor like you. So as you said, rightly said, mentoring is really the great aspect. And for somebody like me, I'm not just mentoring Botswana, but also in Eastern and Southern Africa, because I've gone to Zambia where young children will see me and we say, what do we want to be? And they say, we want to be a nurse and a minister of health. And I say, no, study, be a nurse. The rest will come later. But right now, that's where you go. So it's really that.
Absolutely.
I'd like to pick up on the point about the work environment. I think many of us experience that fourth-year syndrome. I'm in my fourth year at the World Health Organization, and my colleagues are saying the same things about the work environment. So we need to be realistic. But that applies to male and female. And we need to recognize that is part of the challenge of the occupation, is part of the challenge of health professionals in teams. So how do we build the resilience in our student workforce? How do we support them with mentorship and engagement? How do universities take on a responsibility in their education and personal development of the student body to be able to practice in an environment which is going to be a challenge for everyone, accordingly, to get that done? And then the reality of the work environment is, truth be told, is that male nurses are still doing far better than female nurses. if we look at the gender pay gap in the nursing and midwifery profession. Despite having 80 to 85% female workforce, men are still earning more compared to their female counterparts. Now, that's a double-edged sword, because actually in nursing, there is a gender pay gap, but it's probably one of the smallest gender pay gaps that we're seeing around different occupations. So there is greater gender parity in earnings, but nonetheless men are doing currently better than things. So we need to look at what are the factors then around career development, career advancement. What are the opportunities for women to also... We should be seeing a positive gender pay gap for women in the nursing and midwifery occupation, not for men. What are the leadership and development opportunities so there's a bit more parity there?
Sorry, do you want to say anything on that, Menashe? I'm conscious that I've asked a question from there and there, so I'm going to ask one from the last section over there in the corner. And then we'll probably have to wrap up. So.
Sure. So I just want to comment on the aspect of the marketing of nursing, and also on the topic of the titles with regards like sister and matron. And taking from an experience, I just appreciate the comment you just made, Dr. Sheila, in terms of doctor in nursing. In that, well, in Zimbabwe, a lot of the times male nurses are called little doctors. And that statement has always got to me. And I'm like, well, I'm not a little anything. I'm a nurse. So, but like from the comment you just made, it's sort of like changed mindset around that, and that, well, it's a little doctor in nursing. So, yeah, that was a thought that came.
Excellent thought. Thank you. Right, one more question then over here. We've got the microphone. Where's it gone? Oh, okay. Go on then, you've got it.
Then I'll pass this over.
Okay, thank you.
Hello, my name is Catherine Hannaway. I am a global health consultant to the Nursing Now campaign. So very proud of you, Menashe. He's part of the campaign, the global team. Around this room, we've got several others. Would you like to stand up? Cynthia, and we've got Rashid, and we might have as well another Sarah. We brought 4 young people with us, particularly here, to represent young people and to come along and talk to young leaders here. And amongst that group, we ran a workshop on Monday. Prior to that, we'd done one for the senior leaders, because we can't just try to empower and develop young leaders without actually making sure that the more senior are engaged. And some of those people are here in the room too. But we did that for 2 days at the weekend, Professor Charlotte McCardle and I, working with the team here with Professor Deborah White. And then we started to work with the young nurses here. And we've got all of some young nurses that were there, and particularly the male young nurses who were in the room, all part of that workshop, all part of moving together to strengthen nursing. But the focus was improving health. So we're not talking about men and women. We're not really talking about gender. We're talking about where we're trying to get to, and all of them wanting to be in it together. We talked about leadership skills. They're all absolutely keen to develop those skills, and that's what they want from countries, from organisations. They want your support to have that development, that mentorship. They want the authority and the empowerment to move this whole agenda and our profession forward. So we ask all of you to pledge that support to the young nurses, our future. Thank you. Great.
Thank you for the thoughts. And if you pass it over, we'll take a question or a comment.
Thank you. I'm Viv Bennett. I'm the Chief Public Health Nurse in England. I think we have a tendency when we describe nursing to start off very well about the breadth of the career available to men and women, and then to very quickly narrow our debate down to it's about sick people somewhere. And I think as we try to attract more people into nursing, whether young men or young women, or older men or young women, and particularly for the young, when we're talking about trying to attract people who are 10 years old today, we have to be strong in our narrative about mental health and physical health, about prevention as well as treatment, about the whole breadth of opportunity available to people, and try not to get narrowed down as we go on in our discussions. So I think it is a fantastic career for anybody to enter, and it's our duty to describe that as fully as we can consistently. Thank you, Steve.
Absolutely. Right. I think they're going to tell me off about the timing, but if you've got any comments...
Let me follow that. Let me follow that to say, these days when I talk to young people about nursing and encouraging them or, exhorting them, I talk about the Sustainable Development Goals to say that they have a niche in all 16 of them. I think of myself because I had no intention of being in the health field at all. So when I did get that scholarship, because I wanted to do speech and drama, I was told we don't eat that when I was young. We have take this scholarship or leave it. And I simply decided, since I'm into people, I'm going to do more public health. I usually say that to kids and say, look, in your case, if you are interested in life underwater, which is Sustainable Development in 6, I said, you go into nursing and specialize in taking care and making sure that we drink great water and all that. So that's still part of nursing, so that we are looking at the prevention, the treatment, the care, support, and everything. And I think that's where we need to go, not just focus on Sustainable Development 3. We feature in all of them, all 17. Yeah, thanks.
Thank you. Any more final comments from the panel before I wrap it up?
That's my final comment. I already had a final.
You don't have to. It's all right.
So I would just like to take this time to speak to the men in nursing that are here. And it was great spending time on Monday with these gentlemen that are sitting over there. And to just tell them that, you are valued within this profession. And there's so much that you can be able to do. And to continue being you. And to continue reaching for great heights. Yeah.
Excellent thought.
So I'd like to leave with a challenge to our WISH partners and personnel in the audience. This conversation in terms of the role of men and women in careers in nursing needs to be also held as part of the World Health Assembly in Geneva. So I would challenge our partners here at WISH. How can you work with WHO, with the Nursing Now campaign, with student nurses, with the government chief nurses and midwifery officers to bring this conversation to Geneva at the May World Health Assembly? Thank you.
Here we go, a challenge. Thank you very much to my panel. Thank you. So we've got to stop it there.
Thank you.
Thank you.